This one is kind of a old name of this diagnosis. And then the name of this one is acrospiroma. I don't even remember I ever made this diagnosis. This is an old term to include poroma, which is the one we talked previously, and then also hydroadenoma. And then this one kind of combine of two of these entity. You can see monotonous cell anastomosis connect to the epidermis, but we also can see this dermal component, and in this dermal component we can see kind of spread dark differentiation. So if you just see this dermal component, we will call this hydroadenoma. But if we have this multiple connection to the epidermis, monotonous cell, this poroma stroma with dilated blood vessel, this one is poroma, and combine two of these feature, that is acrospiroma. But I don't think it is wrong just call it poroma for this entity. So let's see the more classic one for the hidradenoma. Usually do not have any connection to the epidermis. Low power, kind of well demarcated, kind of symmetric dermal based lesion. And low power, we can see one component is kind of nodular, the other component kind of cystic. So that is classic feature for hidradenoma. We usually can see this cystic and solid nodule, but sometimes they just have cystic component, sometimes they just have nodular component. But when we zoom in, we can see this hyaline stroma, not like chondrite stroma in the mixed tumor. Then of course we can see some sweat duct differentiation. They also have some eccrine material, secretion material. So when you find this hyaline stroma dermal nodule with spread duct differentiation, that is really good for this hidradenoma or hydroadenoma. You can see all of this material just like a spread duct secretion forming this cyst structure. See one more nodular and cystic hidradenoma. This one a little bit weird because it seems they have some connection to the epidermis, but it doesn't matter. Low power, we see this hyaline stroma and then with this cystic area and solid area. And zoom in, we can find some sweat duct differentiation. And in this dilated cystic structure, sometimes we can see this sweat duct material, just secret. So combine all of these features, well demarcated, solid, cystic, sweat duct differentiation, hyaline stroma, the cell really monotonous, no atypia or mitosis. And then, another feature is that we also can see this clear cytoplasm, just mimicking the outer loose shape of hair follicle. Also, it's really good feature for the hydroadenoma.